This is Dr. Dilshuknagar from Daffodils Child Development Center, Hyderabad. So by the term hyperactivity, we mean to say that increased activity levels beyond a point. So till certain extent of activity is considered normal, but when it goes beyond, when it crosses the line, that's when we use the term hyperactivity. Definitely, all the parents who are having this high energetic kids might be facing issues in handling them, especially when we have to take them out to the functions, the social gatherings, or even to the restaurants and the shopping malls. So the basic tips that I could suggest to these young parents who are facing difficulties in handling hyperactive kids is increase their physical activity. You have to understand that these kids has a lot of energies and they doesn't know how to channelize their energies. So with the physical activities, you can give a good option for them in channelizing their energies into a right path. So when they could do this goal-oriented play or any of your physical sports, it could be group sports or the individual sports like skating or taekwondo, their brain and body will get a nice coordination, they will get calmed down and they will try to be more attentive to you, or they will be available more for education or learning new things and also in behaving in a right manner. So physical activity should be your first goal. And second thing is, if you find that your kid is too hyper when compared to the other peer group, please do take a professional help. Get him evaluated by a developmental pediatrician or by a psychologist or a behaviorist and understand the root cause for this hyperactivity. And these days we are also seeing children who are coming under ADHD segment. So ADHD is attention deficit hyperactive disorder. When the kid becomes more active, it is evident that their attention levels also might decrease. When the attention levels decreases, it will hinder their overall learning capabilities. So definitely we as parents has to reduce the activity levels of our child so that their learning capabilities will increase. So if your medical team like pediatrician or your OT person or the behaviorist says that the child is having too much of activity levels, then please do consider attending to the therapies like occupation therapy or the behavioral therapies, wherein these therapies also will help them to calm down. Your occupation therapist will try to assess the sensory segment of the brain also, like how it is taking the input or the stimuli from environment, whether the sensory stimuli are getting properly integrated into the brain. So if the integration is not good enough, even then you will start seeing hyperactivity sort of behaviors in the children. And whereas your behaviorist will try to analyze, is it just a behavioral in nature? Is there some triggers to their activity levels? So if they could analyze the triggers, definitely as parents, the next portion is to reduce the triggerer incidence so that their activity levels will reduce. So please do remember to start working on their physical activities. Please do indulge in a lot of sports. You can start teaching them vocal or the non-vocal music. Along with these three, you have to take a professional help, get them evaluated, if they identify the root cause, and then start the therapies according to the root cause. I hope you understood on how to manage children with hyperactivity. Please don't take it light. The earlier it will be the better, even for children with hyperactivity. And if you have any further doubts, please do post in our comment box. Thank you.